Good evening, everybody. This is Healthcare Bill, video number 29. We are on this paragraph that says adoption requirements, effective dates. Now, for those of you who do not know what I'm talking about, you go to page 30. We're going to be dealing with section 1104. Way down here on a letter B, and it says adoption requirements, effective dates. We talked about eligibility for a health plan and health claim status. Now we're going to talk about electronic funds transfers and health care payment and remittance advice. Okay, electronic fund transfers. This is any time funds are transferred from the patient to the health insurance, from the patient to the health care provider, from the health insurance to the health care provider, or the health insurance to the patient. Okay. The set of operating rules for electronic fund transfers and healthcare payment and remittance advice transactions shall allow for an automated reconciliation of the electronic payment with the remittance advice, and be adopted no later than July 1st, 2012, which we are now approaching, in a manner ensuring that such operating rules are effective no later than January 1st, 2014. Whew. Okay. Now we go down the paragraph just a little bit more. Health claims or equivalent encounter information, enrollment and disenrollment in a health plan. Okay. This is going to be dealing with health claims. This paragraph is going to be dealing with health claims. This is when you make a claim to your health insurance provider about an illness or an injury that you have. This will also involve the enrollment and disenrollment in a health plan. Okay? And that's when you try to enroll in a health care plan, or you try to get out of a health care plan. The paragraph will involve your health plan premium payments. So this is the money you actually, the patient, send to the health insurance provider to stay on the health insurance plan. And referral certification and authorization. This is where your doctor sends a referral, and you have to send that referral to the health insurance to get it approved. The set of operating rules for health claims or equivalent encounter information shall be adopted no later than July 1st, 2014, in a manner ensuring that such operating rules are effective. Okay. So whatever rules remember, we have this nonprofit entity that's setting up rules for the health insurance people and for the healthcare providers. And they submit it to this whatever group, and then they submit it to the secretary. All these rules have to be adopted no later than July 1st, 2014, and have to be implemented by January 1st, 2016. Expedited rulemaking. The secretary shall promulgate an interim financial rule applying to any standard or operating rule recommended by the National Committee on Vital and Health Statistics pursuant to paragraph 3. The Secretary shall accept and consider public comments on any interim final rule published under the subparagraph for 60 days after the date of such publication. So, whatever rules this nonprofit entity sets up and gets approved by the Vital and Health Statistics, whatever, they're going to be put on display, and the entire public can review them for 60 days, and then after that, then the Secretary decides whether they're going to be implemented or not. Okay. Compliance. As if we haven't gone through a ton already. Health plan certification. This is talking about eligibility for a health plan, showing you whether you're eligible or not. Health claim status. Okay, this is where they tell you whether you are eligible for a particular treatment or you're not eligible. Electronic funds transfer, this, and I've explained this many times before, this is when the patient has to pay the health insurance, the patient has to pay the healthcare provider, the health insurance has to pay the healthcare provider, or the health insurance has to pay the patient. Okay? No later than December 31st of 2013, and that is going to be approaching next year, a health plan shall file a statement with the Secretary in such a form as the Secretary may require, certifying that the data and information systems for such plan are in compliance with any applicable standards. Okay, so what these health insurance companies have to do and what the healthcare providers have to do is they have to send a notification to the Secretary saying, hey, we are in compliance with your rules. Okay? And as for health claim or equivalent encounter information, enrollment and disenrollment in a health plan premium payments, health claim attachments, a referral certification and authorization, all these health insurance providers and these health care providers have to be in compliance with what the Secretary of Health and Human Services has to say by December 31st of 2015. Okay. A health plan shall not be considered to have provided adequate documentation and shall not be certified as being in compliance with such standards unless the health plan demonstrates to the Secretary that the plan conducts the electronic transactions specified in paragraph 1 in a manner that fully complies with the regulations of the Secretary and provides documentation showing that the plan has completed end-to-end testing for such transactions with their partners, such as hospitals and physicians. So in other words, for a health care plan from now on to be certified as a health care plan, they have to show the Secretary of Health and Human Services that they have implemented all the rules that the Secretary has said they have to implement, or otherwise they will be a plan. And this thing goes on and on and on. Now, the Secretary himself does not certify the health care plan. This is done by an outside entity. The Secretary designates an independent outside entity to certify that a health plan has complied with the requirements under the subsection. In other words, the Secretary doesn't have a ton of time to review every health care plan to see that it's being compliant with the rules that he has set up. So he brings in some outside non-for-profit group that has nothing to do with the health care plan and lets them decide da-da-da-da. Okay? A health plan, including entities described under paragraph number 3, shall file a statement with the Secretary in such form as the Secretary may require, certifying that the data and information systems for such plans are in compliance with any applicable revised standards and associated operating rules. Yeah, we get the idea. Okay. Now, audits of these health plans. The Secretary shall conduct periodic audits to ensure that a health plan is in compliance with any standards and operating rules that are described, da-da-da-da. So, the Secretary will review periodically whether a health insurance plan is being compliant with his rules. So it's not just the Secretary is going to review this stuff. He's going to bring in a review committee. And this review committee will decide whether a health insurance plan is being compliant with the Secretary's rules. There will be hearings, constant hearings, and they will start on April 1st, 2014. And they will be done biannually, which means they will be done twice a year. And twice a year he's going to review whether these people are doing what they're supposed to do. And then the secretary and this review committee will develop a report, and they will submit this report to the health insurance plans, letting them know if they're really complying or if they need to update something to make them, whatever. Whew. Anyway, this goes on and on and on, and I will tell you more in the next video, so stay tuned.